We can have a fully functional, beautiful crown to correct the angulation of the implant when you don't have enough height of gingiva.
Hi, and welcome back to Uniqa Dental Show, where we discuss interesting cases and new procedures in the field of dentistry. Don't forget to like, share, and follow us to stay tuned up to date. Today with us, as always, is Dr. Yaniv. Hi.
Hi, how are you doing?
Amazing. How are you?
Great.
How'd the week went?
Amazing.
What did you bring for us today?
Well, today we brought a case when we restored the left upper part of the patient, and we had one implant that was a really long time ago placed, the implant on the canine, and the other implants were newly placed. So this single implant had a cemented crown for many years, and later on we wanted to use this implant and add some other implants also for zirconia bridge screw retained. We wanted to use the implant. One of the options is to leave it with cemented crown, and this way we'll have single crown and a small bridge, or we can make a bit larger bridge with one more crown and it will be one bulk. So here you can see the bridge from the occlusal part.
It's a PFM?
This is probably PMMA. It's a temporary bridge.
This is hurt? No, this is...
No, you have two molars, two premolars, and the canine. The canine, you have the implant somewhere here, and here you have three more implants, probably.
This more that it looks kind of broken or...
Yeah, maybe because of her occlusion, the original tooth was worn off or broken. So now if we want to restore with a new crown, we can have a fully functional, beautiful crown because she can't close her mouth. She had a broken tooth, and now the crown will be probably with the same anatomic design.
Because she got used to it.
The antagonist is the same way. She can't have a fully new crown with not worn off. If you have a patient a little old or something, you can, and you're changing only some of the teeth. You can't leave the other teeth worn off and the new teeth with fully anatomical structures like an 18-year-old. So this way, this is why when you change molars, the anatomical design that you'll have in the end will be probably or close to the original one that she had. So yeah, so if she had a worn off molar, the crown will be the same way. You can have it different color. You can have different little effects that it will look nicer. But the original design probably will stay the same or close to the same way.
Because the
antagonist.
Yeah, she gets used to it also in all this time.
So in here you can see three implants. One where the molar is, the second one is the first molar. You have in the first premolar and the old implant for the canine. Originally in here she had teeth and only the canine was extracted. We placed an implant. She had a cemented restoration, cemented crown on this implant, and now we want to change it to screw retained restoration.
It's cemented on one crown she had.
Yeah, one crown cemented.
It's a V-type?
Yeah, it's a V-type multi-unit. It's
got
not
quite
the
an
abutment.
angle.
Yeah, it's quite a large angle. And because of this angle, because probably that she had some bone loss, the implant was placed in this type of angulation. With this angulation, you can't, it's very hard to have a very aesthetical screw retained restoration. It's much simpler to make a cemented crown.
So with this angulation?
Yeah, with this angulation of the implant. So this why when it was a single crown, we made a cemented restoration. Now we want to change this crown and want to add some other implants. So we can have a screw retained restoration and not one cemented and one screw retained.
But why the V-type is used here and not an angulated?
Well, the implant is angulated. Where if you're thinking this way, so we need to put an angulated abutment, angulated multi-unit, to correct the angulation of the implant. But in this case, you can see that the height of the gingiva is very low, it's very small. So if you'll use an angulated multi-unit, you'll have this part of the multi-unit outside the gingiva. It will be very hard to mask it, and you lose all the aesthetical part of the crown. Half of the crown will be metal. You'll see all of this part. So this is why in these cases when we have angulated multi-unit with angulated implant and very low height of gingiva, very small height of gingiva, we want to use straight multi-units, and we even prefer not to screw to those multi-unit and just use those multi-unit or implants as stoppers and use the other implants. We have enough implants for this bridge. This canine, you have quite adjacent implant to the canine. You have the rigidity for the bridge. You just want some of the forces to be distributed to the implant.
So you use it as a stopper, as we discussed in previous cases.
Yeah,
and that's how you fix this problem.
Exactly, and this is when you see the final bridge. You won't see any metal. You won't have any metal color, anything.
So by using a stopper, you solved the functionality stays the same.
Yeah.
And you solve the aesthetic problem.
Exactly. If I had only 2 implants for this bridge, it would be impossible to use one of them as a stopper. So I need to find a way to connect this. Maybe I'll have a cemented bridge. I don't know. But in this case, I can change it to screw retained and use a straight multi-unit with stopper and not using angulated one. Angulated one, you almost always have a problem in the aesthetical part if it's in the frontal area. Because the angulated part, the buccal part of the angulated implant is almost always visible when you don't have enough height of gingiva. And in this case, you can see the stopper. You can see we have 3 screw channels. You can see that all of the screw channels are very small, and we have the screw inside the bridge. We used 3 4mm sleeves and 1 stopper. The stopper itself is about 1.5 millimeters. So it doesn't have any height at all. You just cement the stopper to the bridge, and all the vertical forces that go onto this bridge, onto this crown, on the canine, will be applied on the multi-unit.
Having small screw channels is better than having the regular bulkier.
Yeah, when you use a small screw channel for the bridge, the amount of occlusal surface that's left is much bigger. So in this case, the small screw channel is about half in the surface than the bigger screw channel, and you have all the occlusion, all the occlusal parts of the crown. And the crown itself, for example, when using monolithic zirconia or even PFM, you have more space for metal or more space for the zirconia. The crown is much stronger.
Even on PFM.
Yeah, even on PFM. This way we close the screw channels with pins, temporary pins.
Oh, and then you cut the pin.
Yeah, and then I cut the pin, and this is the bridge that I have in the end. You can see that for the canine, we don't have any screw channel, although we have an implant, a screw retained implant. We have a multi-unit and we have a stopper that we have a sleeve that acts like stopper on the canine itself. Then we had a first implant in the first premolar area, the second and the third in the molar area. This is the diameter of the screw channel. You can see that almost doesn't affect on the occlusal surface.
I'm also looking that 2 implants are here and 1 is here, and here is the stopper, so this distribution of force is very good for this stopper.
And here you have a defect in the bone, so probably it was impossible to place an implant, or you don't even need to place an implant. But for a 5 crown bridge, 3 implants, almost 4 is quite enough. You don't need any more.
That's amazing solution.
Yeah, it's a great solution for some of the cases when you can't have any different solution.
Are there any downsides to using a stopper?
If you have enough distribution of forces, if you have enough implants, it's not. If you didn't have an implant in the area of the first premolar, you can't use a stopper. You can't have 2 molars and then 3 crown cantilever.
So it all depends on the distribution of
It all
forces.
depends. It's to help solving different cases and not as a regular thing you want to use.
Can you use a stopper in frontal area as well if the distribution is good, like on frontal teeth?
It's to solve different cases, to help in different difficult situations, and not something that we use regularly. In regular cases, you want to have quite parallel implants. You want to have the screw channel in the occlusal area. In this case, we had one implant that was a very long time ago placed. It was angulated. Later on, we placed 3 implants, quite parallel. You can see the screw channels are almost exactly in the center of the crown, perfectly positioned implants. And still, we want to have screw dent restoration, and we use the old one. We cannot use it at all. You can put a healing cap or screw cover on the implant, and then close the implant and forget about it.
No,
But
Okay.
why not using it if you can use the implant in some way that will help you?
if he's in a good condition.
He's in great condition.
Thank you very much for being here today.
You're welcome.
Very great case.
Great.
And thank you for being with us today. Don't forget to like, share, subscribe, and follow us to stay tuned with the newest cases. Have a great day and a great week. Thank you.